Thank you for your interest in DOPPS. The DOPPS is the Dialysis Outcomes and Practice Pattern Study. DOPPS is a prospective cohort study of in-center hemodialysis patients and practices based on observing longitudinal data from patients in a random sample of dialysis facilities in more than 20 countries. The DOPPS program is funded by an international consortium of industry, nonprofit, and public funding sources without restriction on publications. We thank our sponsors for their generous support to improve care for our patients. The DOPPS has been collecting data since 1996. We've recently, and are proud to note that we've extended the DOPPS model to other studies, which now form the DOPPS program. These include DOPPS, CKDOPPS, PDOPPS, and the DOPPS Practice Monitor, all subjects of other video overviews in this series. In the DOPPS, data are collected from national samples of dialysis facilities in each country and from samples of hemodialysis patients in each facility. We collect detailed clinical data as well as health care provider and patient survey data. This rich data source enables us to provide a reliable picture of variation in dialysis practices and outcomes in each geographic area. In addition, we perform analyses to correlate differences in practice with differences in patient outcomes, such as mortality, hospitalizations, and patient-reported outcomes, or as now commonly called, the patient experience. These data are used to highlight unwarranted practice variation, and most importantly, to identify practices and approaches that will lead to better outcomes for patients, as well as the overall experience for patients receiving hemodialysis. We're honored that nearly 200 DOPPS manuscripts have been published in peer-reviewed journals to date, and that invited DOPPS symposia are regularly featured at major national and international renal conferences. DOPPS findings have been used to support and refine clinical practice guidelines and have been presented or reported to government health policy agencies and regulatory agencies around the world. Several examples of our high-impact findings over the years include: first, we've highlighted very large differences across countries in the types of vascular access used for dialysis patients and its strong association with clinical outcomes. Specifically, patients with surgically placed vascular access have better outcomes on dialysis. Countries such as the US are doing better, with greater use of surgically placed vascular access, but still have room to improve. Some European countries are unfortunately doing worse than they had been in the past. In other words, they currently have fewer patients with surgically placed vascular access than they had before. A second example is we've highlighted differences in number of hours spent on hemodialysis during each dialysis session, known as dialysis treatment time, across countries. And we've shown that patients with longer treatment time tend to feel better and have fewer medical complications on dialysis. Fortunately, dialysis treatment time is now increasing in the US, though it still lags behind other countries. Dialysis is a life-changing experience for patients. At DOPPS, a major goal we have is to perform and disseminate research that highlights our patients' experiences. As one example, we've recently reported that the time it takes to recover after each dialysis session can be many hours. Thus, with dialysis 3 times weekly, for many patients, nearly half of their lives are consumed by this life-saving but very burdensome treatment. In short, though great strides have been made with hemodialysis care, much work still remains to be done to improve our patients' lives. We look forward to continuing to work with you to meet this goal. Thank you for your interest in the DOPPS, and please contact us if you'd like information on how to work with us to help improve lives for our patients with kidney disease.